Olive Shisana joins us now from our Cape Town studios. She's director of the HSRC and has worked in the field of HIV and AIDS for many years. She's currently the director of social aspects of HIV, AIDS and health. Welcome, Olive.
Thank you very much.
Olive, on the 25th anniversary of World AIDS Day, what part of South Africa's approach to this fight has changed over the last 25 years?
Well, the HIV/AIDS epidemic has actually improved in terms of the management of HIV/AIDS epidemic. The country has improved tremendously. We actually are seeing fewer deaths. We are seeing lower HIV infections in young people. We are also seeing increased proportion of young people that are becoming circumcised. So on the prevention side, I can say that things are beginning to get better. On the treatment side, I think that the country has done extremely well, exceptionally well actually. And then in terms of mortality, in terms of the number of deaths, we've actually seen fewer and fewer deaths occurring. So things are looking better than they were several years ago.
Fabulous. What is the latest research saying about the infection rate now? Who's getting infected?
First of all, I wish I could give you the results of the new infections, which we are beginning to analyze this week. We will be able to finalize our HIV incidence, but what I can tell you is that young people are less likely to become infected now than ever before. And the reasons for that is that they are using condoms to prevent themselves from becoming infected with HIV. The ones we are worried about are the older people, those 50 years and older. Those are the ones that are less likely to use condoms. Those are the ones who are less likely to understand the HIV transmission. Those are the ones that are likely to become infected with HIV because they do not have sufficient knowledge. Part of the problem we have is that we've all concentrated on the young people to prevent them from becoming infected with HIV, but we didn't do much with regard to the older population. So all of us need to start saying, I am an older person, I'm responsible for preventing HIV. My country is taking responsibility for ensuring that knowledge is transmitted to the relevant people in the country.
And access to medication, Olive, is that still an issue? Now that we have the one-pill drug solution, is that helping with distribution?
Access to medicine is always a concern. It's a concern because the healthcare system itself needs to improve tremendously in terms of its ability to deliver the services. We've got excellent policies that say that we should be able to provide antiretroviral therapy for all of those who need it on the basis of criteria that has been set up by government. So those people who fall under the categories that the state says they must be able to get ARVs should be able to get ARVs. But unfortunately, in many of the facilities, there are challenges. And some of those challenges are mainly because there are not enough health workers to be able to provide the services. I do not have the figures clearly in terms of what proportion of the population has not been able to access antiretroviral therapy when they needed it. But what I can tell you is that 2 million South Africans were able to get access to antiretroviral therapy when we conducted the survey in 2012. And this is a very large number. Obviously, it's large because of the fact that we've got the highest HIV prevalence in the world. But nevertheless, it means that those people who are HIV positive and are eligible to obtain antiretroviral therapy, we are actually providing them as a country.
So the reports of stockouts, that would not be a budgetary issue, but rather a logistical problem?
I think it's a logistical problem. I don't think it's a budgetary issue because if you look at the figures of how much this country is actually spending on HIV, it's quite high. Much of the funding that is ring-fenced for the Department of Health, the bulk of it actually goes towards antiretroviral therapy treatment. So my view is that we need to jack up in terms of service delivery in order to make sure that those policies that have been passed are made real.
Thank you very much, Olive. That was Olive Shisana from the HSRC.
News that moves. eNCA.com.